the evolution of erect posture means repeat means from quadruped, if we have evolved, then we were, the whole spine, I told you earlier, the spine, so the whole weight of the body is coming from front and then, but the things radically changed when human beings evolved as a erected spine. Now, so the muscles, as you go, you will see in the abdomen, or you just see like this, you see the muscles. I don't have muscles now, but I never had. But of course I have muscles, but what I want to say, like our Salman Khan and all these people, that when you will be reading the skeletal system, means anatomy, you refer to the skeleton, which is one is in your dissection hall and one is here. Now, if I have given you the mala, both mala in Kumbh Mela, you can go and do some Shahi Shan. Okay, one thing I tell you, that see, now you see the cervical spine. The spine, the main thing is that it has a body, it has some processes, it's some spine, it has a canal. Okay, and according to from the brain, at your skull bone, the foramen magnum. Now, as the spinal cord comes from cervical, it comes, the spine, though your neck movement, you can do this, even who are in very postural, means dancers, I would say, or acrobats, their movements of the spine differs from, it doesn't differ, but what I want to say, the cervical, the total spinal cord is descending from the brain at the foramen magnum and goes down. The canal is going, it goes. Now, according to the এইটা লাগাতে এইদিকে এই সামনে পড়বে See, the canal is triangular, but as you go up, it is circular. Okay? Now, you just see, when you pick up, you just you pick up any bone. If you, what I want to say is that you have to distinguish between a cervical vertebra, a thoracic vertebra and a lumbar vertebra. But owing to its characteristics changes according to the position where it is, and what is its function, and the total body weight and the total movements is altering its shape. What I want to tell you in just concept. Now, you see it is concave, this surface, convex, this thing. Naturally, now it articulates with the one convex, one concave. In between there's a cartilage, hyaline cartilage, and that even the intervertebral disc. And except due to some trauma, and it can happen in any place or part of the spine, but we are very easily we get, you lift a bucket of water, or suddenly you get your prolapse intervertebral disc. The disc prolapses, and as the spinal cord is coming through the foramina, that will depend how much it is there, how much it is the disc has prolapsed. Now, this can be with an ordinary radiology plate, say X-ray. If it is a large-scale trauma, then there might be fractures, there might be displacements. But if it is casually when you are moving or walking or you're running, you pick up a bucket of water or your luggage, boarding Santiniketan Express. Naturally, you get a click. You might not hear the sound, but it is painful. Suddenly you sit down. So now, what are the muscles of the back? And anteriorly it is supported. Muscles, ligaments, and of course this is supplied by the nerves, and there's vascular supply. Now, the lamina, the processes, the concave surface, the convex surface, in between there is cartilage. You can see the body width, but this is shortened, anterior posterior is shortened, but it is this is the canal. Okay. Now, if you see the anterior ligament and the posterior ligament, when you dissect the dead body, and that is important, the crus of the diaphragm, you have red thorax, it is upper three lumbar on the right side, the crus, and and left it is 1, 2. Because see, it is due to the position of organogenesis and all this embryology. And naturally, now I think you won't mistaken, and between the thoracic and the lumbar vertebra, thoracic has facets, costal facets. Lumbar doesn't have, does it have? No. So in between the cervical vertebra. Cervical vertebra, there is no costal facets. And so I think you just 3 vertebra you just see and pass it down, feel it, see it, feel it, see it. Now I told you earlier that these are the crus of the diaphragm, the psoas majors. Okay. Now if it is the left side, then 2 vertebral, right side, 3 vertebra, it is attached. It's a when you open the abdomen and all the visceral contents are removed, you will see the psoas in your book. You will see a triangular muscle. It's coming in the posterior wall from this level. It's like this, it's an expansion like this. It's expansion like this, it's triangular. And the basilar artery, lumbar artery, these are the vessels that is supplying from the abdominal aorta. And the venous drainage will be through the venous plexuses